Welcome back to our community talks again. Today we have special guests who are advocates for women and empowering for women's health. With us, Dr. Bindia. How are you today?
I'm good, thank you. How are you?
Very good. So Dr. Bindia Jam is a British board certified consultant gynecologist with over 20 years on clinical experience, surgical chair, and head of gynecology at Yas Clinic Khalifa City. Not only she is a top clinician, but also a leader in the medical training sector. With us as well today, Justina Wolna, who is the founder of Just Yoga Birth. And Justina is another advocate and empowering for women through her yoga and mindful movement and breath nurturing, well-being from teenage years for women all the way to wisdom years. Welcome to both of you. With me as well, my colleague Bashir, who is going to be a guest as well today and help me in carrying this conversation from a different angle. So welcome to all of you.
Thank you very much for having me in this conversation. And women's health is something which I'm very passionate about, and I believe women's health needs a center stage. So thank you for this cause.
Thank you.
Thank you. Also, I feel really honored to be invited to this part of community. I feel it's amazing that elder community brings movement, mindfulness to all the communities. It's a pleasure to be here. Thank you.
Very much.
I'm very happy to have you with us to speak about such an important topic, to be honest.
Thank you. So now it's currently the Breast Cancer Awareness Month. So I'd like to start off by asking you, Dr. Bindia, about how important it is for us as a community and society to come together and spread awareness about breast cancer and how important it is for us as women to have this increased awareness about our own bodies.
I'm very pleased we are touching upon something which I would say is not a medical diagnosis. It's a story that is close to many women. I would say on an average, 1 out of 8 women are likely to develop breast cancer. And why it is important to raise awareness, not just in the month of October or the pink month, but all the year round, is because early detection saves lives to the extent of 90%.
Wow.
And when I'm in my clinic, I must say I try my best to push every woman to get herself screened.
Mm-hmm.
And screening is one way to pick up the disease, I call it a disease or cancer, earlier. So women do not undergo aggressive treatment and they can get back to their lives as before.
Beautiful. Is it true that 50% of diagnosed women are through self-examination?
I would not put a number to 50%, but what I would take the opportunity to tell women, it's very important that you do a regular self-breast examination. And when I say regular, it means at least 1 week after their periods.
Mm-hmm.
And if they find anything that did not exist in the previous month, it's better to come to the doctor and get it clarified.
Nice. And is there any early stage symptoms that women need to be looking at or be aware of?
So it's very important to have a look at the breast, any change in the appearance, size, color. It's not just being fixated about a lump or, for that matter, pain.
Yeah.
It's, let's say, in my experience, I had a patient who was having very itchy breasts, and she presented herself to the department. And unfortunately, she had breast cancer, and it was not one of the very common breast cancers. So anything like a discharge from the nipple, the shape, the color, the size, or anything that you feel has not existed before, that could be a sign of cancer. Although most of the time it is not, but it may be.
So how often should women do like the scanning, and when should women start doing mammograms?
So basically there's something called risk stratification. There's something called low risk, average risk, moderate risk, and severe risk. So when I say severe risk, it means that they themselves had a breast cancer before, or somebody in the family, or there's a genetic component that was running in the family. But let me come to the simple one first. So let's say there's no history of breast cancer or any associated cancer in self or the family, then starting from the age of 40, and this is based on the American college guidelines. If we follow the British guidelines, they say even from the age of 50. But it's always good to be safe. So start from the age of 40, all being well, every couple of years or annually, one can get a screening test up. Now, what does a screening test involve really, in addition to the self-breast examination by a trained clinical professional? It's a breast ultrasound as well as a mammogram. Now, I have seen patients, they squirm and they raise their eyebrows the minute I mention mammogram. And I would like to take the opportunity, yes, mammogram can be uncomfortable, but it does not increase your risk of having breast cancer. And also, yes, it has to be uncomfortable because it is like, imagine you put the breast through a scan machine. You want to make tiny sections and slices so we don't miss out anything. And I always say a stitch in time saves 9.
Yeah, absolutely. And what are the things that women can do to actively work on preventing cancer? Is there such thing?
Definitely. And there's a lot of drive these days about lifestyle. Lifestyle modification, longevity, health, care of your health, and how it starts is being aware. I believe awareness is a very important thing. A woman, and this is a great opportunity, women know 1 out of 8 chances to have breast cancer. However, certain risk factors like obesity, so work on your body weight, the kind of food that you're eating, get a dietitian on board if you're not sure what works well for you, because you can say generally having anything which has got lesser processed sugars, more of antioxidants, fruits, you can say berries and cherries and nuts and green vegetables, and an amount of protein, certain supplements, all this omega-3, all these are very, very important. And something which is extremely important is to be as stress-free as possible, have an adequate sleep, good hydration, and last but very important is a certain amount of exercises, yoga, meditation. So I hit hard with the lifestyle advice. And I know that in this busy life, everybody wants, okay, let me pop in pills and I'll be fixed. No, that's a quick fix. That doesn't go far. It's ultimately, it's your body. Be aware of it. You're working for yourself.
100%. Actually, it was really one of the questions that I really wanted to touch base on. I mean, how much the lifestyle really choices makes a difference and really matter in the health of women in general. I think you really cover it overall. So thank you for that.
Yeah.
Thank you.
And Justina, speaking of yoga, why is yoga important specifically? I think we touched base on stress, and I see the correlation.
So yoga is amazing to reduce our stress, inflammation in the body, reduce cortisol, and all the negative aspects that can have on our body. When it comes to a woman, from teenagehood, the awareness of our body is so important. So as young girls go through their cycles, monthly cycles, to pay attention, to be aware of what's happening in their body, to slow down, adjust their physical practice and physical activities to slow down, or the time when they feel more active. And especially when it comes to women, and yoga and breathing, the breath is so crucial. The understanding the anatomy of and the functionality of the breath, our lungs expanding, the diaphragm muscle that descends, and then we have the pelvic floor. The pelvic floor that is so well attached all around from pubis, hips, our sacrum, lower back. When we take a deep breath, all our muscle works in synchronicity. So when our lungs expand, diaphragm descends, we want to encourage expansion of the pelvic floor. And what is very important for a woman as they go, especially pregnancy, childbirth, and later through the wisdom years, when we want to make sure that the pelvic floor, that supports our organs get strengthened. We want to always create the upward energy, and together with the breathing, it really enhances as this is our foundation of the core. And there's within there is 70% of a short fiber muscles that gets activated only through deep conscious breathing. So together with the breath and also our nervous system, so the yoga helps us boost our immune system, and with the nervous system, especially our parasympathetic nervous system, that gets activated only when we are in a state of a calm and relaxed.
Beautiful.
Now we have the nerve vagus that runs from the stems of our brain down to our chest and abdomen cavity, attached to our internal organs. When we use mindful breathing, mindful movement, this activates the nerve vagus and calms our body. That's why it can heal during the rest. So even with the movement during yoga and breathing, we can enhance our longevity. And this comes also when it comes to a deep relaxation and visualization, that with the breath help our brain to rewire. So when we do it over and over again, helps our brain to rewire and heal even on the cellular level. So yoga is like a bridge between the science and our self-care. That's why it's so amazing for a woman, because it brings us to our body, to awareness through the breath.
Amazing. Beautifully put. Thank you for that insight. I enjoy yoga, but now I'll make sure it is part of my routine.
I am very much encouraged to take up yoga.
Yeah. Yes, exactly. And, you know, thanks to you and to Bashir, now we have, you know, this wellness drive going on in various communities, and that is to basically give the opportunity for people to try it without thinking about how much I'm going to pay, how long you know, I need to drive to get to a yoga place. So now it is available within our communities on weekends. So please, for anyone watching this, just check the wellness drive dates and times and try it for yourselves, and hopefully that will create the same energy that I feel now from you, Justina. So thank you very much. This covers our breast cancer awareness and information. When I was preparing for this session, I was surprised that it's not breast cancer that is, you know, the #1 risk on women's health. However, there is another factor, which is the heart health, which is more important, and it is the #1 impactful disease on women. And we don't speak about it, we don't hear about it so much. So let's move to matters of the heart and speak about, you know, the heart health and what is the difference between heart attacks or heart well-being for men versus women.
It's very interesting, and I absolutely agree with you that matters of the heart for the women is more like a forgotten territory. I would say it's a myth when people say, oh, women will not suffer from heart attack. You'll be surprised. The highest number of mortality that has been, as per the database in UAE, is related to heart attacks in women. And to make matters a bit more challenging, the way the heart conditions present or heart attacks present in a woman is completely different to what presents in a man. So something like, let's say if a woman says she's feeling gassy, or she's feeling, she's getting the heartburn, or she's feeling a bit queasy, chest pain, of course, it takes us all by, you know, there's a no-brainer when somebody says it's a chest pain, you want to exclude a heart attack. But at the same time, if they feel they're a bit too tired and non-specific symptoms, you know, let's say they feel very pukish, for example, and pregnancy has been ruled out, these can very much be the symptoms, even the early symptoms of a heart attack. And there's a hormone called the estrogen hormone, which is very important to protect the heart in women.
Yeah. Is there any difference in, you know, the heart between men versus women? Is there like the size is different, the way, you know, the heart functions?
The heart functioning, the physiology stays the same. The heart pumps the blood and it goes everywhere in the body. But of course, again, anatomically, a man and a woman are different. The function stays the same.
Yeah.
So the amount of blood volume in a man's body is different. So the work that the heart does in a man's body is different to a woman's body. But the basic essence is the same.
What about stress, actually? Does really stress impact women different than men?
The impact of stress is, I would say, is similar for both men and women. So it's a very, I mean, we do make light jokes about it. Oh, women can cope with everything. The heart doesn't know that they are able to cope with everything. And this is on top of all the stress that is, you know,
100%.
mental, physical, lack of sleep, lack of exercises, lack of yoga, multitasking, as they say. It does take a big toll.
Right. And we see a lot of women now, to cope with stress, they go for smoking and vaping these days. How direct has an impact on women's heart?
I would say both vaping and smoking is a big no-no. They're the enemies of the heart, let's put it this way. But if you're vaping to get rid of smoking, remember that the future is more important for you. So get rid of the vaping as well. The only difference is, one is, I would say, smoking has got lots of toxins in addition to nicotine, but vaping has got nicotine as well. And you're fooling yourself if you say, okay, I'm vaping now, so I'm safe. No, not at all. The heart doesn't like either.
Right. And they both have the direct impact on
Direct
the heart.
impact.
What about diet? Actually, how come like a very, very small thing like salt has so much risk on women's health and women's heart?
Yes, I mean, one would think, take it with a pinch of salt. No, the heart doesn't take it with a pinch of salt. Any added salt is harmful across all stages of a woman's life. And that's why we always say, be very careful of having added table salt to your food. It affects the blood pressure, and the blood pressure is directly affecting the heart. Because if the pressure in the blood vessel goes up, imagine your heart has to pump with greater energy to overcome that pressure in the blood vessels. So rather these days, you know, it's very commonly said, a low fat, low sugar, low salt diet. This is really true for the heart.
Right. And we recently, I mean, me personally, I see a lot of education related to muscles and, you know, exercise for women, but I rarely see education and I mean, videos that really touch on the bones and the important how to take care of women bones.
Yeah.
So
thank you for bringing this, you know, and this is an uncharted territory for women. They do get taken by surprise when you say, watch. So when I see women, especially in the middle age, I always tell them, watch your brain, heart, and the bones. And this is extremely important, especially, I would say, past the age of 50, almost 50% women, their bones start weakening. And there's a medical term for it, which is called osteoporosis. So just to give you an idea, you have the normal bone strength, and at the other extreme end, you have extremely weak bones, which is called osteoporosis. Just prior to that is osteopenia. But again, lifestyle, eating healthy, exercises, and being aware of your family history. So when I say family history, if let's say if your mom has had weak bones and she sustained a fracture, let's say at the age of 40 with a minor trauma, your alarm bell should start ringing. Could that happen to me as well? And there are certain medications, particularly the steroids, they weaken the bones. Coming to smoking, smoking is not bad only for the heart, but smoking, I will say, it dissolves the bones. So it is active or passive, both are equally bad for the bones.
But why it seems like it targets women specifically?
The incidence of osteoporosis is 1 in 3 for the women and 1 in 5 for the men. but because, and women again, I would say after a certain stage of life, because there's a very important hormone that we are born with, that's estrogen. And after the age, or rather I would say between 45 and 55, the level of estrogen hormone starts depleting. And the answer to you would be that because it starts depleting, more so in women, women are more susceptible to osteoporosis.
Right. Thank you.
So
Thank
hormone
you.
changes and so
Small changes, but make a big difference.
right. I always wonder, like calcium, we have milk, low milk, full fat.
Yes.
So which one is better?
So it depends the angle you're looking at. If you're an obese woman and you want to lose weight, then you don't want to go for a full fat. Now, the amount of calcium is pretty much the same. And then I would like to talk about vitamin D as well for the bone health. It's protein, calcium, magnesium, vitamin D, vitamin K. All this is very important. And there is the evidence is a bit sketchy about whether every woman should take calcium. And there's also some medical evidence which a couple of years ago mentioned that calcium is harmful for the heart.
Yeah.
And I have brought this debatable topic. If in doubt, and let's say a woman is being advised to take calcium, and she mentioned she's not sure about her heart health, might as well get an internal medicine or a physician who deals, or a cardiologist. Just make sure and get the blood levels done for calcium, magnesium, vitamin D. If you are very sure that you're taking a quantified amount of calcium through your, let's say, dairy products, whether full fat or skimmed milk, as long as you're taking about 1,000 to 1,200 milligram elemental calcium, it doesn't matter. You don't need to take the calcium supplements. The million-dollar question is, are we able to quantify? Are we that regular with our dietary intake? So just to add in our busy lives, so we don't miss out, take the calcium supplements.
Okay. So is there any symptoms that we need to watch out for to predict or to predict that we are going through, like bone density, loss, or, how can we know other than hereditary
Rather,
factors?
yeah. I would say sometimes the earliest symptom of osteoporosis or weak bones is a fracture for no reason, or a minor trauma. But obviously, knowing your background in addition to the family history, have you been a smoker, active or passive? Be mindful that your bones could be weak. Have you been on steroid treatment for any reason in the body? You got to be mindful. Also, obesity, sedentary lifestyle. It doesn't help the bones.
Yeah.
And of course, the kind of food we are taking in.
Since you touched base on estrogen, like, is it necessary to do scanning, hormones, to substitute through hormone therapy? What do you think about that?
Yeah, in addition to the lifestyle advice, the supplements, hormone, I will say I am a big advocate for hormone replacement therapy. And lots of studies that happened before, especially the Women's Health Initiative study, which is a very popular study, has been revisited. And what it mentioned earlier that it's harmful is actually now proven that hormone replacement therapy is rather protective for women. But again, one size does not fit all. Don't take it over the counter. Go to your doctor, let them do a detailed risk assessment. Then they will talk to you about whether you take estrogen only, or do you take a combination of estrogen, progesterone, and testosterone? Do you take it as patches, pills, gels? But estrogen is extremely important. It's anti-inflammatory. It's important for the bone health in addition to everything else.
That's
Right.
wonderful.
Another question about lifestyle. Like, how smoking, how big is the impact of smoking on bones, women bones?
I would say as much as 50%.
Whoa,
It is that important.
that's
Smoking,
huge.
yes, in my experience and medical literature, it has got a huge impact. Although I say 50%, but let me put it this way. Everybody's body is different. So I've had patients in my clinic who've said to me, oh, I've been smoking and nothing happened to me. Don't take your body for granted.
Yeah. Um, Muscles and bones. So, is there correlation between, if your muscles are stronger, this means you would have, stronger bones, or there would be a reason why, you're specifically for the back. Um, like, is there a correlation between muscles and bones?
So, muscles sit on the bones, as we know.
Mm-hmm.
Bone forms the core of the bone or the skeletal system. We say it forms the core of the body, but both are equally important. If you have weak bones and a strong muscles, which is unlikely, to be honest, it's 1:1. It's an indirect proportion, direct linear proportion, I would say. So keep your bones strong so that the muscles can be strong. And both are very important, for the health of women. And I would also like to say that there's something called bone density check, or DEXA scans, as we say. And it's important, specifically, I would say, for women above the age of 40 who've been having a good, healthy life. From 45 years of age, there's no harm in getting a screening test with the DEXA scan to find out how much more attention do you need to give to the bones. And swimming, weight-bearing exercises, they're so important for our bone health. They're small things. Imagine, I remember telling a patient of mine, do weight-bearing exercises, skipping. It's so good for the bones. Impact exercises, swimming. And they were shocked. They said, oh, I have a pool in my house. I said, make the most of it. So it's a lot we can do with lifestyle, with supplements, with hormone replacement therapy, with exercises and yoga for our women.
Beautiful. So now let's move from the bones to the soul and the mental health. So we as women, like we mentioned, stress on multiple, occasions today. Stress, mental health, we hear a lot about eating disorder, anxiety, and these are all, come with the modern and busy, stressful schedule for women today. That we're trying to balance, the kids, the house, the career. We're trying to do everything in one go. How is that impacting, our souls and our mental health?
I would say if you don't have a happy soul and a relaxed mind, it's very difficult to get through the day. And women, by default, we don't like to prioritize our health. We like to do, okay, let me look after the family, let me look after the kids, let me do A, B, C, D, E. And then finally, when you're thoroughly exhausted, you say, oh, leave it. I can just ignore. And I would like to take the opportunity. You're trying to pour out of an empty cup. You're running on it's like you're running a car without the fuel in it. It will only go this far. So, of course, we're living in the world of AI. Life is not going to get any easier, but we should learn to juggle and prioritize and not feel guilty. I will say across different cultures I have seen in my practice, women tend to feel guilty when they think about themselves. I want to say remove that. If one thing you can take out of this, for those who are listening to me, don't feel guilty. Prioritize looking after yourself. And you're not being selfish. You're filling in yourself so that you can give more to your family, your friends, your career, the community. Because when you give to the community, it's like you're joining hands together. And I remember when I came to UAE in Abu Dhabi in 2016, and the first time I asked a patient who was above the age of 40, so how do you feel today? And I said, do you have any hot flashes or night sweats? She was so surprised. And she said, Dr. Bindya, after I made babies, nobody bothered asking me.
Aww.
And today I see that the seed that was planted, we have so many, women's health webinars, and, we have menopause. That was unheard. It was a taboo to talk about it.
Sure.
And now everywhere you go, people are talking about menopause, midlife women's transition, or wisdom years, So it's a great opportunity through community talks to link women across different phases of life, to talk about their problems to each other.
Absolutely.
Sometimes we can just find a solution while
Mhm.
talking to each other, or we just need somebody to listen to us.
Yeah, and sometimes, you would feel that, okay, I have certain symptoms. You know what? It is nothing. You go to the checklist, and and I'm one of those like that Google symptoms online, and to check what's going on. Oh, it's nothing. So you just, as you mentioned, you keep yourself as the last priority in your daily
Right,
schedule.
then there is a very important point. Actually, we spoke about it today. At the end of the day, if the mom is not like healthy or tired, so it really affect the whole family, and then the balance in the house, like really,
Yeah.
it's not there
That's why I
anymore,
believe
and this has a
self-care
direct
Yeah.
very important.
impact on the kids
Absolutely.
and husband.
Yeah.
Yeah.
And I was coming to that, it's the men are very instrumental in giving that opportunity to the women, that they're
Of
course.
just caring, asking, how do you feel, how was your day,
Right.
Mhm.
any way I can help you.
Mm.
The woman feels that she gives in so much to the family.
Right.
Somebody is there to ask her and make her realize that she is also flesh and bones.
Right. Beautiful.
Absolutely.
Beautiful. Justina, you wanted to mention something about self-care.
Yes.
Yeah.
So the self-care is very important. I like to highlight, even from when I teach teenage girls, that self-care is not about laziness. It's to bring awareness to your body.
Mhm.
And as I also mentioned before, yoga is the bridge between science and self-care. So lots of yoga poses helps to regulate your blood pressure,
Mhm.
to slow down, and also even calcium level,
Mhm.
because it works on our hormones. So like, for example, we can elevate our legs. That will also help with our heart. Lots of inverted poses. So for example, we can do a shoulder stand and follow up after shoulder stand as a counter pose. It's a fish pose. And that so in the shoulder stand we have a pressure here on the thyroid gland, and that helps to also regulate our metabolism. And then when you do counter pose, when we open the shoulder and chest, we are massaging the parathyroid gland, and that helps to also with the level of the calcium. So this self-care and bringing yourself the connection between our heart area and our womb area, this is such a beautiful connection that we carry within us, and is to acknowledge that from the young age.
Thank you. Another new term that we keep hearing, and I'm one of those, brain fog. Sometimes, just wake up, I have a brain fog, you tend to forget more. Is there a specific reason? And let's not mention age.
Yeah, not the age, and also I would like to say it's not even very gender related anymore. Brain fog, what used to be, according to the medical evidence, that brain fog happens to women 40 and above or 45 and above. I think it exists very much in the men also. I mean, this is experiential talking. They tend to forget, but why it happens, I wouldn't say it happens more in men and women. The data, their medical evidence is very sketchy. But the so-called midlife transition, there's a shift in the hormones. You can have a brain fog if you've been awake for 36 hours. It's very normal. The body is trying to reboot itself. But we shouldn't stigmatize as brain fog. It's rewiring of the brain. But yes, a good night's sleep, a good hydration, eating healthy food. Yoga has a great impact in, minimizing brain fog. So I would say that, I thought I had a brain fog right now.
We need water.
I need hydration. Yeah, so it's not to stigmatize it. And again, when you start talking more about it, you're raising awareness, and you will notice I've even had 25 years, they say, I forget where I keep my things. It's not something so unheard of or unnatural. It's the brain.
Yeah.
It needs a sleep, it needs a break.
100%. So the sleep is really like a key factor
Very
to,
key
yeah,
factor.
to cope with brain fog.
Very nice.
And the hormones.
Mm.
I would say as the estrogen levels do go down, and there is a direct correlation of estrogen and brain fog, that as the estrogen levels go down, the brain fog is likely to increase, but not the only reason is the hormones.
Okay.
So one may have perfectly normal estrogen levels, but they're not well slept, they can have a brain fog.
Okay, interesting. Coffee, caffeine, is it a cause of brain fog or not related?
I would say caffeine is a double-edged sword, you know. It's good, it improves the metabolism, and a cup of coffee a day is not bad, but if you're addicted to coffee, then it is not so good. So everything in
Right.
moderation is okay.
And I
Yeah.
think also caffeine, you can correct me. I mean, early in the morning is really better than taking it in the afternoon, because that can really affect the sleep. It has direct correlation with.
Absolutely. So if you choose a particular time of the day, the best time would be early morning coffee.
Beautiful. Loneliness, which is another thing that is very important to maintain our mental health. So us as a community, we try to build always bridges, build connections with everyone in our community, and this is one of our main pillars. Is it related to mental health?
Definitely, and especially post-COVID. COVID taught us that we have to learn to live with ourselves. However, you know, it's like a bright side to it and a dark side to it. The dark side to learning to live with ourselves is we have forgotten human interaction. And during COVID time, when I was conducting deliveries of kids, and those kids who have grown up, when I talk to them, or anybody, any human approaches them, they're not sure how to behave with them. Loneliness can impact big time physical health, mental health, and we need to develop various community engagement activities where people come together. I mean, I come from an era where if I touch you, I'm okay with it. But if I have somebody like the Gen Zs, they're not used to, I have nothing against the Gen Zs, but they're not used to a pat on their back. They will get very startled if you say, hey, how are you doing? They'll get very surprised. So that is a different kind of loneliness by choice, but it has a great impact, you know. I would say more so negatively.
Nice. So that's why we continue to work on building communities, bringing the people together, whether it's for health values or other environmental values, etc. So everyone can share their interest and share their thoughts. And again, like if you feel that you are part of the community, you feel stronger. You feel that you belong. It gives energy. Like just having this,
Yes.
sitting, talking
Yeah.
to you, it's really reflecting and giving me the energy. So this is the kind of gatherings that we encourage in our communities. Even the way we design the lobbies, the way we design our community rooms. So we are conscious of that, and we hope to have more and more events and gatherings. Well, thank you very much.
Thank you.
Before we close, I just want to check if we have any questions from our audience online.
If anybody is on a restricted diet, let's get their calcium levels checked, let's get their magnesium levels checked, and let's get their vitamin D levels checked. If they are low, definitely put them on supplement. My experience, in my opinion, is that even if it is a normal calcium level and there is no underlying heart condition, to maintain the calcium level, especially in women who are dieting or they're taking a restrictive diet, keep them on a certain level of calcium supplements. Coming to counseling, I'm very glad you touched upon it. I am a big pro for counseling. What we call as counseling, so let me put it this way. We all are having a good time talking to each other. All of us have had a long, busy day. And coming here energized, having a discussion energized us, exchange of information. We look forward to meeting each other again. If we do this on a more regular basis through a special, let's say, a specialized clinician. So we call them psychologists or psychiatrists. Let's say somebody is going through depression and they are open to talk about it. We need to create a safe space for them to talk about it so we can guide them. So counseling is a great way. I mean, either counseling with friends. We can start with if you feel safe talking to your friend about it, go for that. You feel safe with your family, ask somebody, have a mentor who can mentor you through loneliness. Or if you're not comfortable, if you feel that home is not a safe space, friends are not a safe space, go to a psychologist, psychiatrist. There's no taboo about it. See, when we put on weight and we don't know how to lose weight, who do we go to? We go to a doctor, we go to a dietitian, we go to a yoga instructor, guide me, how can I lose weight? So same thing it is with the mental health counselor. I want women to take a I really want to give that message out. If you feel you need help, it's good at least you identified, go ask for help.
Absolutely. We have many questions online. How can we encourage more investment in new technology and products specifically for women's health needs? So I keep getting this question, like, is there enough research on women's health?
I would say it's enough is it's never enough. Because the demographics is changing, everything is changing. So we really would like to have more financial investment and more time investment into researchers. And sometimes, as I mentioned, calcium, is it safe to take? Is it not safe to take? It's still open for debate.
Yeah.
So we need more researchers, but more, in addition to the financial and the time, sometimes we get the outcome is equivocal. It's a gray zone. So we continue to develop more, let's say AI is coming in. We develop more technologies to identify solutions.
Absolutely. And I think we are leading here in AI, and we're lucky to have all of these new technology being applied. But also, I think if women continue to advocate for their own health and put themselves first on the agenda of the healthcare, then women voices will result in advocating for more research that is happening. So yeah, I think it's driven by the people and what their need. Just voice out a concern, and we keep putting our health on top of the agenda.
Women empowerment.
Exactly.
I believe you can empower a woman if you empower her with her health, physical and mental.
Absolutely. Another question on the importance of nutrition. So I think we touch base on this, but if you'd like to give like a summary on nutrition.
So I would say one size does not fit all. You need to go to the dietitian. And we often say, and I myself included, okay, I'm going to cut down on my carbs. I'm going to cut down on this. It's going to work for me. That's just my assumption. Best case scenario is go to the dietitian, talk to them. They're going to work out what are your do's and what are your don'ts with their nutrition.
Okay. The next one is a very important question. I've heard that postpartum women can experience a weakened immune system. Is that true? And if it is, what are the best ways to support its recovery?
I would say not only postpartum weakens the immune system, the period of pregnancy itself, we say it's an immunocompromised state. It's the pregnancy leading to postpartum. It's the immune system is compromised for multiple factors. Presence of any medical condition weakens the immune system. And how we can improve it is first identify, is it a weakened immune system? And there are lots of checklists to go through. And of course, again, going back to the mother doesn't get enough sleep. Not getting enough sleep weakens the immune system. Not eating the right food weakens the immune system. Dehydration, not doing yoga and exercises, it weakens the immune system. So postpartum, again, I would say, let's go back to our basics. Eat healthy, live healthy. And yoga, we talk a lot about yoga these days, but yoga existed centuries ago. It's now that it's being revisited because our lifestyle makes us think, oh, what was so natural part of our life has been a forgotten story.
Yeah. So, Justina, since we're talking about pregnancy, is there specific yoga prenatal, through pregnancy, and post?
Definitely. Yoga for pregnant women varies quite different to the postnatal because it's a very different focus. First of all, for women when they are pregnant, we want to help ease off any discomforts what they are experiencing. So there is so many, from shortness of breath as the baby is growing, her digestion is, her intestine are all squashed for so many months. So even though we have hormones that's supporting us, it's a huge pregnancy. It's a huge impact on our body, like you said, that autoimmunity impacts. So being self-aware, well nutrition, well sleep as much as we can, it's very important. And breathing, also focus on the pelvic floor during pregnancy. We want the pelvic floor to more of bringing visualization that we can open and strengthen. While when we are after giving a birth, we want the pelvic floor that supports our organs, we want to strengthen. So, and postnatal yoga would probably more relate to a wisdom age yoga, where we want to have more of the upward energy. While when we are pregnant, we want to also bring a really connection between us and our baby through breathing, because at the end of the day, this whole journey, it's done together by the mother and the baby. And when the time is to give a birth, so the yoga can support you through breathing and visualization, so you can cope with the intensive surges. And even if you have a cesarean, the hormones are still playing a role. So the way how you are feeling during a cesarean, if you feel supported and safe, this can still, as the hormones are how to say, have an internal dance between your baby, will have a impact how the outcome will be.
Amazing. Well, we're talking about women above 40. What are the essential health checks, supplements, and lifestyle habits that every woman should focus on to maintain her overall health and well-being?
That can go on for, I would say, hours and hours. What women above there, just to make it simple, go to your gynecologist, go to your, if you have no other problem, you're not taking medications for any healthcare conditions, just go to your gynecologist. They will do a top to toe, what I say, body MOT, which includes, breast examination, pap smears. I'm still surprised, many people, when I ask them in my clinic, many women, have you had a pap smear? Okay. Have you had a Papa Nicolau test? And I show them the pictures. Oh no, I never had that. What on earth is that? That breaks my heart. It's another kind of, one of the important health checks is, you want to know that, if you do a simple thing like brushing the cells from the neck of the womb or the cervix, you can identify a cancer which you can prevent at early stages. Getting a blood work done. And what I do when patients come to me, I do like a hub and spoke model. Okay, you've come to me, I've had to run through your history, I have examined you, and all the women tests I have given to you. But I always say, okay, go visit the internal medicine. Why? Because they're more specialized in that. Maybe there's something that is going to be unmasked. Okay, go to the cardiologist, go to the endocrinologist. I always say, you have taken time to come this far, make complete use of the opportunity.
Absolutely. And what a more beautiful gift that a woman can give herself on her birthday more than an annual physical. So I think timing the annual physical and annual checkups to the birthday is something that every woman should do. And this way you don't forget. You always remember, on my birthday I'm gonna do a full checkup. This is my treat to myself.
That's very beautifully put across.
Yeah. There is a beauty question. Beyond skincare, what lifestyle or nutritional habits truly slow aging and keep skin, hair, and energy levels healthy after 40? Yay, we have lots of over 40 in the audience.
Yeah. So again, one size does not fit all, and one doctor, so myself as a gynecologist, would not be able to tick all the boxes. But how I can help these women is, of course, your general well-being, your hydration, lifestyle advice, eating the right kind of diet. So again, I mean, what we do in our hospital, we have some things called a specific kind of food based on your genes. We have internal body analysis. And I will share my experience here that when I went on the internal body analyzer, I was shocked. I was blown away. I said, no, that's not correct. And I did it again after a month. I said, it blew me off, and it helped me realize that I need to go to the nutritionist or a dietitian to understand what should I eat. And that ties in very well with skin health, hair, nails. I refer these patients to a skin doctor, dermatologist. So it's all of us come together. Yeah. And it's like the petals of the flower coming together in the center, and the center is the woman.
Beautiful. The last question is, what advice would you give to women who are already having a healthy lifestyle, but even then they suffer from premenopause symptoms? Do you think those ladies need consulting or need to go to a gynecologist for this?
So let's say a woman has been doing exactly everything textbook style, and she's still suffering like hot flushes, night sweats, or mental breakdown. Yes, definitely. You can start with either going to the gynecologist, and then they can guide you where all to go to. If you can't get hold of a gynecologist, or you're shy of going to a gynecologist, you can even start with a family physician. But start somewhere, because every small step is eventually going to have a big impact. And remember, you're doing it for yourself. And what better way to treat yourself, particularly on your birthday, would be to, be cognizant of your health, your needs.
Amazing. Before we go to Justina to show us some easy exercises that we can do on daily life, I would like to get closing remarks from you, Dr. Bindia, and then Bashir, and then we can, show the audience few moves that can help them.
If there's one thing I want the audience to take from this is, put yourself as a priority to your health. I would like to empower all women, and it's nothing stupid to, like, when you go to a doctor, asking any question is not stupid. It's related to you. Think about yourself first, and then you can give to your family and your community.
Thank you.
Right. I mean, from me, I think really knowledge and awareness really play a big role in maintaining a healthy lifestyle and healthy life. And obviously, having the right routine, diet-wise as well, and exercising, and so having the knowledge, because even now I came to learn so many things from you, what you're introducing in the clinic as well. These things I didn't know. It really helps a lot. So I think knowledge is very important, and definitely this will let people have a stronger body and brain really to cope with all the stress and the challenges that they face day-to-day life.
Thank you very much. My message would be, love yourselves and advocate for yourselves. And at the same time, if you're not happy with consultation or not happy with your doctor, seek another opinion, and always make sure that you have a good doctor. So thank you very much, and thanks for the audience online. And Justina, we can't wait to see those moves.
I might just start from tomorrow.
No, there's now.
No, I'm saying I'll follow from tomorrow.
Regardless, wherever you are, whatever you are wearing, yoga is simple. So let's start sitting comfortably. Ideally, legs are hip distance apart, or making sure your spine is upright, shoulders relaxed. Feel free to place your hands perhaps facing the ceiling. Have a fixed eye gaze to start with. Take a deep breath in, ideally through your nose. Gentle pause and slow breath out, ideally through your mouth. Breath in. Breath out. Paying attention, your jaw is relaxed. Your teeth are not touching each other. Now, let's take your head all the way up, having a nice stretch of the throat muscles, helping to really move the muscles, as yoga is amazing to moving the muscles we don't even know that exist. Swallow saliva 3 times in this position. And then bring your chin to chest. Bring your head to the center. Take your one hand behind your back, the other hand somewhere behind your ear, giving yourself a nice stretch. So your shoulder is opening and neck is stretching. Breath in, breath out. And then change. Other hand behind your waist and the other where's your ear, giving yourself a nice stretch. Come to the center. Take your hands on top of your thighs. Take a deep breath in. Draw your shoulder blades together. Look up. And as you're breathing out, chin to chest. Breath in. Look up. Draw the shoulder blades together. Breath out. Chin to chest, rounding the back. Breath in. Paying attention. My upper, middle, lower back. And as you're breathing out, again, nicely rounding the shoulders, and then come to the center. Take your right palm facing the ceiling, the left palm facing the floor, and do 30 times pumping. What does this do? So this is helps especially when our this is awakening the muscles in the palms, also connection to your shoulder, even to your chest. And then swap 30 times. Keep breathing.
Really much enjoying this.
Oh, excellent. And then relax, sense the energy activated in your palms, spreading to your elbows, into your shoulders. Then let's take a right hand, left hand over for a half eagle pose. Trying to wrap as much as you can. Lift your elbows up and chin to the chest, allowing yourself to stretch nicely your shoulders. Breath in, keep pulling the elbows up, chin to chest. And slowly.
I think I need to wear a yoga costume.
And
Yeah, a bit difficult with the jackets. Trying.
Lift your elbows up, chin to chest.
This is impossible.
Yeah.
Breath in, breath out, and
Yeah, good luck for you.
slowly relax. Now from here, I want you to take your hands on top of the rib cage. Fix eye gaze, paying attention. As I take a deep breath in, the rib cage expanding. And as I'm breathing out, the rib cage sinks in. Breath in, rib cage expanding. Breath out, rib cage sinks in. Continue this breath, paying attention to my left and right foot firmly attached to the ground. There is a connection between the feet, the pelvic floor, and as I mentioned at the beginning, the pelvic floor muscle is breathing with us as the diaphragm. All the muscles are works in harmony. Feel free to continue have a fixed eye gaze, or you may close your eyes. With your mind's eye, see your lungs expanding as you take a deep breath in, allowing the horizontal diaphragm muscles to, like a parachute, to descend. And as you're breathing out, the parachute ascends, lung
comes back, relax. Take a deep breath in. The breath in allows you to bring a lot of space to your chest area, so your lungs can bring a lot of oxygen into your body. And as you're breathing out, everything sinks in. Continue this breathing. And with your mind's eye, see now your left hip, your right hip. Then the sacrum, the triangular shape, the tailbone, back to the left hip, pubis bone, and into the right hip. And there, within that space, well-orchestrated muscle, pelvic floor in the shape of a hammock. As you take a deep breath in, the hammock expands downward. And as you're breathing out with your mind's eye, see the hammock gently lifts up, diaphragm ascends. And breathe in once again, everything expands, diaphragm descends, pelvic floor expands downward. And as I'm breathing out, everything lifts up. Feel free to take one hand on top of your chest, other your hand on the top of abdomen. Acknowledging the link, the chest area, the heart, the source of unconditional love, and the pelvis area for women, the womb wisdom, and the connection between the heart and the womb. Womb source of creation, and the heart source of unconditional love. Bringing awareness to my heart. Feeling my heart beat, rhythmic heartbeat. And as I'm breathing out, I relax further and my shoulder drops further into the frame of my body. Acknowledging this time, this special time, honoring all women who are perhaps still fighting, healing, or just need the space in their heart to let go. My whole body is relaxed. As my mind leads, so my body follows. As my body is relaxed, breath steady, mind calm, so is my body. Releasing anything that does not serve me any longer. And with your eyes ideally kept closed, bring your hands in front of your chest into the prayer and rubbing your hands against each other, creating all the lovely warmth emanating through the palms. And once you have sensed it, gently massaging over your forehead, cupping your eyelids, sensing the warmth, charging your mind with positive thoughts, feeling gratitude for my body and mind being able to do what it's doing. And spreading over your cheeks, extending your hands in front of your face, looking straight into your palms. Looking forward to the rest of the lovely day. Thank you.
Thank you.
Thank you. Thank you very much. Thank
was
you so
lovely.
much. That was amazing.
Yeah, it de-stressed me through.
Yes, absolutely. Thank you so much. Thank you, everybody. Thank you,
you all.
Albert. Thanks, Naima, Muhammad Kareem, everybody here. Bashir,
Thank
shukran.
you.
Yeah,
Thank
of
you.
course.
Take care.